Good morning, everyone, and thank you for joining us this morning for today's webinar. Allow me to introduce myself. I'm Anne Livingstone and I'm the chair of the Community Care Smart Assistive Technology Collaborative. I'm pleased to be the moderator for today's webinar, the focus of which is caring for people with dementia. Our webinar today is facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. If you've joined us before at previous webinars, you'll know that they're designed from feedback and requests we receive through the collaborative, as well as they focus on projects that are emerging through the efforts and partnerships from our collaborative effort. And today's webinar is one such project. Our focus of webinars is to bring together local, national and international perspectives in research and development, as well as the deployment of smart assistive technology in the community care sector. Global Community Resourcing has extensive international links, and we've been fortunate enough to work with many international projects and research entities. Some of our colleagues internationally are indeed on the line for today's webinar. Just a reminder, if you haven't formally registered at the collaborative site, it's accessible to all and free to register. The registration details are on your screen now. By way of a disclaimer, please note that neither Global Community Resourcing or the Department of Communities, Disability Services and Seniors are promoting any particular product, research entity or organisation. Rather, the purpose of the webinars is to serve and to inform viewers of various smart assistive technologies currently in deployment, in research or in development. In today's webinar, we welcome any questions, but to let you know in advance that all microphones have been muted. This is in the interests of recording. Your questions can be added, though, to the question pane on the right of the dashboard. There will be an opportunity to have your questions answered at the end of the session, but at previous sessions we've been inundated with questions. So the earlier you post your questions, the more questions we can respond to. In today's webinar, we have two presenters, Professor Lynne Parkinson and Annie Banbury, and they'll focus on a recent Department of Health Dementia and Aged Care Innovation funded project, Caring for People with Dementia. Today's presenters have valuable knowledge and experience in research, and specifically in research in issues related and of interest to community care sector. And I'll quickly introduce them before we start. Professor Lynne Parkinson will focus on harnessing innovation through the deployment of leading-edge technologies to enable virtual support groups. Professor Parkinson is an internationally prominent population health gerontologist, and she has over 20 years' experience in presenting talks, workshops and symposia at national and international conferences. As well, she has had a primary role in organising conferences in her speciality area of ageing. Our second speaker is Annie Banbury. Annie will be focusing on co-designing with carers of people with dementia. Annie is a researcher, lecturer and consultant who is an experienced public health practitioner. Annie recently completed a PhD entitled Digital Futures, E-Health, Health Literacy and Chronic Disease Self-Management for Older People. By way of introducing today's presentation, I'd just like to let you know that the Community Care Smart Assistive Technology Collaborative is proud to partner with Central Queensland University in this project. And the project is really investigating new ways to support isolated carers, and particularly carers for people with dementia. So why is this project really important to our collaborative and I guess to the body of national research? There is a body of research that is indicating that technology in all forms can make a significant impact in supporting carers, but particularly in supporting remote and isolated carers. The government is also recognising that assistive and smart technologies can play a part and are funding this in such programs such as the Home Care Package program and the National Disability Insurance Scheme. But what we know from the work in our collaborative is that much more research is needed, and this project is a really important piece of work to add to that body. We know that there are some research that's already taken and been undertaken, and I would like to particularly note the early work of Hammond Care in this space. That Hammond Care received some funding through the Empowering the Carer Through Assistive Technology in 2011. And they looked at a range of technologies and looked at their impact in supporting carers. And subsequently, the projects have been funded for Hammond Care, have included testing out the role of technologies like VidAIs for people with dementia. I also know that our colleague Dr. Kevin Doughty is on the line today, and I'd like to highlight the work that he's carried out internationally through his International Centre for Usable Home Technologies. This centre is leading research into smart homes and smart home household appliances, as well as focusing on telecare and telehealth. Kevin's particular interest, I know, is supporting carers. He's one of those many carers himself, and he's also focusing on the quality impact and progressing significant international work in that area of quality impacts. We know within our collaborative that there are many projects happening, and robotics is one area in which it's happening, assisting carers with a range of tasks from lifting, moving, supporting activities of daily living, companionship, etc. We know the uptake of robotics is fairly low in Australia, but we are also involved with countries like Japan, where super aging is occurring and technology is being used much more at greater levels than we see here nationally. We know also that within the work that our collaborative is doing, that partners are looking at how technologies can both revolutionise the types of services that are being offered, but revolutionise and better support carers through that. And we know that there are a range of projects that are occurring in our collaborative and becoming mainstream and giving people real options that are different from the historical set of service menu options that previously were provided. And we know that there is evidence that carers can benefit by considering the uptake of technology, and I've just listed a few of those. Certainly lowering carer stress and fatigue is one of our key goals. But this project that we're highlighting today is about connecting carers with other carers and potentially support. So I'd like to formally introduce the presentation today and acknowledge the funding that has been made for this project. Significant funding was gained by a collaborative submission to the Dementia and Aged Care Services Innovation Funding, or commonly known as DACS, funded by the Department of Health Ageing Branch. This new funding is aimed at supporting emerging priorities and challenges in aged care, but actually really targeted specifically at dementia care and building a body of evidence of what works in quality service interventions. It's now my pleasure to introduce Professor Lynne Parkinson, who's going to provide the first presentation in today's webinar. Thank you, Lynne, for joining us today. Lynne's joining us from Rockhampton, and we believe that cyclone's on its way, Lynne. So over to you now, and we look forward to your presentation.
Thank you, Anne. Good morning, everybody. So I'd like to tell you a little bit about the Caring for Carers and People with Dementia study and the background of that study. What is the Caring for Carers program? As Anne said, our mission is to connect carers with other carers. And what we are doing, we're testing whether video conferencing can achieve this mission for us. Currently, there's over 400,000 Australians living with dementia. Each day, there's an additional 244 people in Australia living with dementia. It's the second leading cause of death in Australia, By 2025, which we have to acknowledge is actually not that far away, there will be a need for over 250,000 community carers and over 120,000 aged care facilities, which is a bit scary. We also expect that dementia will be costing Australia $19 billion per year. Dementia is personal. More than 200,000 Australians provide informal care. So it touches a lot of people in their household, among their family, among their friends. Surprisingly, in 2012, this is a statistic that a lot of people are quite surprised by, I guess, 92% of people living with dementia in the community received informal care. That is, they were not living in aged care facilities, they were living at home or in someone else's home. The carers are mostly the spouse or an adult child. 2/3 of carers are women, and 50% of these are aged 65 years and over and have their own issues to deal with. So how did we develop this study? There was two underpinning studies. One was When the Care Journey Ends, undertaken by Jamison in 2016 in collaboration with me, and the Telehealth Literacy Project, undertaken by Annie Banbury 2014 to 2017, who will be presenting after me. When the Care Journey Ends, we talked to people who had cared for people living with dementia who had now died. There's actually a lot of info out there about carers in the care situation, but not so much about what happens after that care situation stops. So it's understood that socio-emotional support from family and friends is important for adjustment to the role change and dealing with grief of moving out of that care role. Regular contact, the ability to talk about their family members and their support network, and can give people a more positive transition out of the caring role. If they don't have contact with family and friends, or they're unable to speak freely, then it's a much more negative transition. And we heard stories of breakdown after the care role had finished. Feelings of guilt in post-care are particularly a barrier to positive transition. So there are many support networks and resources available for carers of people with dementia, and we have to acknowledge that. However, we have found that in rural Australia, knowledge about that availability and the utilisation of that support by informal carers is actually lacking. Access to support can be limited due to difficulty leaving the family member, particularly for those living in rural areas where there's less likely to be someone to take on that role if they need to leave the house. So carers in rural Australia are socially as well as geographically isolated. So that was our first project. The second project was going on sort of over the top of this other project, was the Telehealth Literacy Project, where we aim to develop and test a home-based video conference group program for older people with chronic disease. So the participants and facilitator were 300 kilometres apart. Contact was through video screens. These were just bespoke video screens developed for another wider study, which is looking at healthcare at home. There were 44 group video conference sessions of 45 to 90 minutes each. There was an average of about 4 participants each, and the average age was 73 years. And I think that's an important thing to note, that they were 73 years old on average. So what were the outcomes of the Telehealth Literacy Project? There was very high acceptability. Technology fears were overcome, particularly for women who express more fear about technology. Social support can be provided by video conferencing groups. And a quote from a person who took part, a participant, was, "I thought we had established a little community. It would be nice to meet up and continue to know each other." So there was a real feeling of being in a group, and being part of a group via video conference was actually really easy for older participants to do. So when we join together the first When the Care Journey Ends, we know that carers in rural Australia are socially as well as geographically isolated. The Teleconference Literacy Project, we know that group video conferencing is acceptable, feasible and effective for patient education and social support. And past studies in group video conferencing show that there's high levels of acceptability and a reduced sense of isolation. So we really wanted to know if this model would work to reduce social isolation for rural carers of people living with dementia. What is the program? As we've said a couple of times, it's connecting carers with other carers. What we're going to deliver is six 2-hour sessions, or around 1.5 to 2 hour sessions. It's going to be 6 to 8 people per group. We'll have an experienced facilitator, and the program will be co-designed collaborative with Carers for Carers. Now that process is happening at the moment, and Annie's going to tell you a lot more about that after this. When's it happening? We're going to have 30 to 36 groups. And it's starting in April, and going through till May 2019. It is a research project, so we are going to ask carers to complete 3 online surveys, and we're going to have in-depth interviews with probably half of those people. It is a randomised waitlist design that we're using, so that what we're doing is starting one group or in the program and having another group which waits, a comparison group which waits for the program to start. So, and that will be randomised. We're actually trying to find out whether this sort of program has an impact on self-efficacy, on mental health, on quality of life, and also their feelings about their health literacy and their feelings about digital technology. We're contacting them through the Community Care Smart Assistive Technology Collaborative Platform. We're looking at local care and provider groups, primary healthcare professionals, newspaper articles, social media, and we're having events in some focus areas throughout Queensland. However, this program is open to everybody around Australia. So if you are a carer, please join the program. If you know a carer, please tell them, who you think might benefit from this program, please tell them about it. This is the project team. As Anne said, it's a collaborative. There's a lot of people involved from a lot of different places around Australia and internationally. And that's how you get involved. That's how you contact us. So thank you. Thank you for listening today.
Thank you, Lynne. Great presentation and great overview of this project. It's my pleasure now to introduce Annie Banbury, who's going to talk about the co-design aspects of the project. Annie, can I welcome you to today's presentation?
Hello, my name is Annie Banbury, and I have been leading the development of the programme content for the weekly meetings of the Caring for Carers of People with Dementia Project. As Lynne mentioned, I undertook the development, implementation and evaluation of the Telehealth Literacy Project for my PhD, which was the key piece of research that underpins this programme. During the Telehealth Literacy Project, I worked with a group of older people with chronic disease to develop a video conference weekly programme that focused on health literacy and chronic disease self-management. For this project, I am taking the learning from the previous study and working with carers of people with dementia to co-design a 6-week programme that can be delivered by group video conferencing. So what does co-design mean? It is a process that we use to involve the end users in designing or creating a service, in this case, the weekly programme. The process has been around for years under different names, such as participatory research or action research. The most important aspect of the co-design is that it puts people with the lived experience of an issue at the centre of a design process. So in our case, it acknowledges that carers of people with dementia are the experts in this area, and it draws on their collective knowledge and experience to inform our programme. Experienced carers of people with dementia guide us to ensure that the final programme is relevant to carers' needs. To guide the co-design process, we have used the double diamond model. In this model, there are 4 distinct phases: discover, define, develop, and deliver. It has been previously used successfully in a number of health and social care projects, particularly in the reorientation of services to become more patient-centred. It's a creative process where a number of possible ideas are created, divergent thinking. These ideas are then refined and narrowed down, convergent thinking. And this process happens twice, once to confirm the problem and once to create the solution. We recruited a group of carers who all had access to a desktop computer or tablet computer. The group met by video conference in a series of meetings to work through the co-design process. Organisations such as Dementia Australia, Carers Queensland help support recruit these carers. Group members were consulted on the best dates and times of the meetings. Group members were given IT support to connect them to the virtual room in a test call before the first group meeting. This was done by sending an email with a Zoom web link to connect the carer to a virtual room. The first time the web link is clicked, the Zoom program is downloaded onto the participant's computer. A very simple process. This takes about 3 clicks. Each week, an email is sent out with the new web link, and each participant clicks onto the link and they are immediately taken into the virtual room. This is what it looks like on the screen. All participants can see and hear each other, and I have the ability to share slides. In each session, I run through the protocol of using group video conferencing, such as the importance of only one person talking at a time, using the mute button so that if there are interruptions in your home or background noises, then others cannot hear them. In the first meeting, we developed our ground rules, which included the importance of confidentiality. And at the beginning of each subsequent meeting, I remind the group about the importance of confidentiality. Our carers came from as far north as Port Douglas and as far south as northern New South Wales, a distance of around 2,000 kilometres. They had a range of circumstances. Some were spousal carers, others were caring for a sibling or a parent, and one was in the post-care period. Only one of the carers had experience in using group video conferencing, and most had not used or taken part in any video conferencing. Their caring journeys were all unique, but within the group, we identified common themes that were important to all. Thematic analysis was used throughout the co-design process. We started with carers sharing their caring journey. This helped map the services they had used, things that had worked well, and also problems they had encountered. The carers' journeys were analysed to identify the common problems participants had faced and also ways they have been able to overcome the problems. Over the course of a number of meetings, the group identified skills they felt was important for carers to develop or issues they felt would be helpful to discuss. These are some examples of the carer skills identified. Advocacy. The group identified that at certain stages of the care journey, they needed to speak on behalf of the person with dementia. For instance, a common story in the early stages was that carers and their loved ones had been to the GP to discuss issues that were concerning. They felt that these symptoms may appear to be dementia. However, they were often told by the GP that they didn't think anything was wrong. This led the group to discuss the importance of documenting symptoms that were concerning. This could help to build evidence for the health professional to make an informed decision and monitor issues over time. The group discussed that to be able to advocate and feel well understood, they needed to develop a close relationship with at least one health professional, both to be able to discuss their issues as a carer and also issues concerning the person with dementia. Being able to talk honestly and feel listened to was key to this relationship. The communication with the health professional needed to be two-way, sharing of information and understanding what was required after leaving consultations. Another issue was navigating the increasingly fragmented and complex health and social care system. For some, they were grappling with consumer-directed care and choosing a health provider. Understanding and clarifying what were the needs of the person they were caring for and their own needs in support of the caring role was important. The group discussed ways in which these needs were met with examples of very creative ways of using care packages to provide tailored care for the person they were caring for. Other issues such as grief and loss were discussed, and the importance of acknowledging these feelings, as well as the ability to find quality information, particularly online, and knowing whether the information is relevant to their circumstances. The group listened to each other and acknowledged the unique and difficult journey that they were all walking. The group members truly understood each other because they are walking similar paths. For the final programme, after the initial getting to know each other session, group members will have the option to discuss one of the prepared topics. For the discussion topics, there will be slides that provide information, for example, explanation on My Age Care, and the process for getting a care package. But the aim of the programme will be for carers to connect and support each other. There are many good quality education resources available, through organisations such as Dementia Australia, Carers Australia. What we seek to do is different to pure education. We seek to use new technology to bring people together in a safe and empathetic space to support their caring role. If the groups wish, we will be supporting them to continue meeting after the 6 weeks. This will be discussed on an individual basis with each group. So how do you get involved? If somebody would like to join the programme or even find some more information about it, please do contact our project manager, Atosha Clancy, and her mobile number and emails are on the screen. Thank you.
Thanks, Annie, for that presentation. Really great presentation. I'd remind everyone that to post any of their questions on the question pane to the right of your screen. We've got a number of questions already in, and I'll try to direct them to either Lynne or Annie during the course of the question time. A question from Casey to either of you, so I might direct this to Lynne. Lynne, Casey's asking, he notes that in the co-design group you had a carer of someone in residential care. Is this project open to carers who have already placed their loved one into residential care?
That's a good question. We actually, for the co-design, we wanted to get, I suppose, the full spectrum of people's experiences and that sort of what the care relationship really was, what that role was. We would prefer people who are currently, we think we'd be most useful for people who are currently caring, but we aren't actually going to exclude people in that way. So we would have to take that on a case-by-case basis. If someone is really wanting support out there and they ask if they can be involved, we're not going to say no to that person being involved. It's certainly not the people we're targeting, but if someone comes forward with who is no longer in the role, we're not going to say no.
Okay, thanks, Lynne. Another question for you. This is from Thomas. Thomas is saying, is commenting that digital inclusion is a really big issue for carers, that many carers, as you know, are financially disadvantaged, but they're also disadvantaged in terms of the sorts of ability they've got to be included in the digital landscape. So Thomas is asking what is the technology that's being used and how user-friendly is that technology?
Well, that's actually a really good question, Thomas, because one of the things I didn't emphasise was, in fact, we're using their own devices. We can provide a tablet if they don't have a device, but we aren't including people who don't have internet connection on their own. One of the big, I suppose one of the things we are testing is that concept of using your own technology, simple technology, off-the-shelf technology, rather than bespoke technology, which is often big projects will develop the technology themselves. We're using an off-the-shelf software and off-the-shelf devices. So we're trying to include as many devices, including old PCs, as we can. So we're using Zoom as our software, and it's usually pretty stable and can be played on most technology platforms. So we're really taking any technology that comes, and even though we can provide a tablet if someone really wants to be involved, but they don't have a tablet or device of their own.
Great, thanks, Lynne. I've got Marie Claire, thank you for your question about is there a flyer that I can email or give personally to my customers. Her role is in dementia education and training, and we'd love, I'm sure, to have you involved, Marie Claire. So we would love to send you some brochures and some flyers and contact you after the webinar. Thank you for posting that question. Michelle is asking a question about, may I ask a question about the language being used? I think, Michelle, you might be referring, is this program open also from people from called backgrounds? Is that the sense of your question? Perhaps you can clarify that on the question pane. But I might give that one over to Lynne at the same time.
Yeah, that's actually a really good question. I'd have to say at this stage we're English only, but I guess there's definitely potential for this rolling out to other languages, and that would be something we'd see as I suppose a vision for the future for this. If we show that it's successful in our English speaking community, then perhaps in our core community it would be as useful. So we don't have that ability right now, but it's actually something we really need to be aware of and keep on the back burner there. So more questions like that, and we'd be really happy to work with someone who has that background to get some funding for that to happen.
And Michelle, I note that you've posted a number of other questions, and we'll look forward to having a chat to you after the end of this session about those. I've got another question from Corey, and I'll direct this one to Annie. Annie, Corey's asking, what does the support look like that's being offered during the group sessions?
So for the very initial setting up of the Zoom link, what we do is we contact the person to be on the phone when they first click on to that web link. Now, when I did it with my co-design group, I made a time with each of the people, and out of those 6 people, 4 of those people were in the virtual room before I had even made the phone call. So it really is a very, very simple process. For the other 2, we were able just to be on the telephone whilst I clicked on those web links and then did the 3 steps to get into the virtual room. And once that virtual room has been set up for the initial call, then each time you go back, each time you access Zoom, you don't need to go through those steps again. You just go straight into the virtual room. So, and we've had very few technical problems at all. And what I really want to stress to people is that it is so simple to use this particular method, to use this Zoom, because I find that a lot of perhaps older carers are a bit hesitant. It's something that they haven't experienced before and they're a bit worried about it, but it is really something that we support, and once they use it, they are amazed, and their confidence in digital literacy actually improves as well.
Thank you, and I'll direct the last question to Lynne. Lynne, we've had a comment in the question pane, and thank you for this comment about the use of the term rural carers as being the only carers that may be perceived as isolated. And Michelle makes a great point that even people who live in metro areas are sometimes extremely isolated and don't get visits during the week and don't get contact. Would you like to make a comment about how the project might be able to include or address those issues of people who don't live in isolated areas but are as isolated in their caring role in urban communities?
Look, I agree absolutely that isolation is not about geography. And I think that this type of program could certainly help people in metro areas. I think that isolation that a carer feels, though, is somewhat, it's emphasised, it's multiplied by being in a rural area as well, and having that just a lack of resources. There's some out there, but certainly not as many resources as there are in urban areas. Certainly, I think this would be wonderful in metro areas, but we are focusing at this moment in time on rural people because of that. We actually have had some very distressed people saying, I just need to be in this, who have contacted us. And we're using rural, regional broadly. Unfortunately, I suppose we're cutting out metro at this moment in time. That doesn't mean, again, that once if this is shown to be really effective, then it makes sense that it goes everywhere. I think it would be really useful for those people who have the same issues of being demobilised, stuck at home because they can't get out, they can't leave the person they're caring for. So yeah, it's a very valid point.
Thank you, Lynne. I'll just finish with a a comment and a question from Jude. Thanks, Jude, for posting this. Jude says, I can see that this could be a real benefit for so many in the future, and wonder if one day these support groups might be accessible through sites such as those run by peak organisations. Any thoughts, Lynne?
I think that would be a wonderful idea. That would be our dream if it became that I suppose mainstream that peak bodies would be offering it. I think it's where we'd like to go. If it proves to be helpful and successful, we'd like it to be everywhere and outside Australia as well.
And Lynne, I guess part of the project is sharing those findings with
Yes.
the rest of the community care sector, carer groups, carers themselves, and promoting it, and I guess lobbying and advocating with governments, funders and policymakers the importance of, considering the important link new technologies are playing in supporting isolated carers. So I'd just like to close today's session by thanking our presenters, Professor Lynne Parkinson and Annie Banbury. I'd like to highlight that a number of questions we've received through the question pane today relate to more material from the project. We look forward to posting it both on the collaborative site, but also sending you individually emails. But on your screen at the moment is the project manager, so we'll let that screen sit there for a little while so you can copy down the direct contact. Atosha is leading the management of the project, and she can be contacted at either of the email address or the telephone, and we'll circulate that later. In terms of a couple of events we've got upcoming to promote this project, we will be focusing on the project through a variety of events in Rockhampton. We're yet to finalise the date, but that should be finalised in the next couple of days, but it will be in August 2018. If you're a provider or a carer or indeed just involved in a local service group, we'd love to hear from you to target and tailor our offerings while we're in Rockhampton. Equally, in September, we'll be visiting Cairns and we'll be doing an array of activities in Cairns. And more information can be obtained from Atosha at the email we showed you earlier, or indeed contact us through sat@communityresourcing.com.au. So by way of finishing today's webinar, I'd like to acknowledge the collaborative project team, and indeed today Georgie Gould and Claire Webby for their work on the presentation and the recording and editing of today's event. Our collaborative is backed by an expert reference team, and some of those reference team members are on the presentation today, so I would like to formally thank them. Thank the Queensland Government for its seed funding for our collaborative, and specifically today's presenters, Professor Lynne Parkinson and Annie Banbury. Thank you for your contribution today, and thank you everyone who's been in attendance today.